on YouTube tonight, right?
Yeah.
Try the sex talk. Okay, is it illness or pain, physical or emotional pain related to birth, infertility, termination, or miscarriage? That can impact sexual arousal. Miscarriage is sexually traumatic of a miscarriage. Surgery, especially sexual organs, mastectomies, hysterectomies, and its effect on self or partner, body image stuff. Severe illness, including diabetes, hypertension, cancer, or any chronic illness can have an impact on it. Having a cold, or being sick, can have an impact on it. Is it developmental? Is it life stage? Anxiety at the start of relationships, symptoms of premature ejaculation and vaginism, exhaustion with young children, lack of libido, midlife, old age. Some of it's kind of normal, right? I mean, you know, if you're 85, your body's not going to operate like it was when it's 20. And if you have someone come in and complaining about sexual arousal disorder at 85, you gotta say, it is what it is. You know, there's not a fountain of youth. You hang on to it this way. I think it's interesting how even like Viagra and some of these other medications try to extend the sexual acting of men for probably more years than they should. You know, because part of the sweetness of ending life together is returning to the pre-marriage state where everything is emotional and spiritual and intellectual intimacy. You know, so I think to like overcompensate for that. I'm not making a statement about never take Viagra. What I am saying is that there's something to be said about honoring life's rhythms, right? It's there on purpose, not to circumvent everything. But there's actually goodness in it. If we have one goal in mind, then we miss out on it. If our goal is to be sexually aroused all the time, we're going to do stuff that's going to interfere with what could be a blessing for us. All right. Is it educational? Many people who present with sexual difficulties appreciate having their physiology explained. Girls receive little training in sexual activity that is not prohibitory, and boys, on the other hand, don't learn to enjoy more gentle touch for comfort and connection. Okay, so you guys probably did not have a good conversation about education. Like, how many of you in here know the phases for a woman? The 20-minute phases. Right? That's super helpful to know the 20-minute phases. In every single phase that the vagina and the breast go through across the 7 phases. Things look different, they feel different, different things happen in the body across all those phases. Same thing for a male. Across the 4 phases, things look different, they feel different. And so like that's just really helpful. Also, like sexual positioning stuff. Right? Okay, so I'll give you some examples. Certain sexual positions are pro-intimacy positions. And so if a couple is complaining about resolution and about connection, then sometimes you can ask them about their sexual positioning. Like, how do they position themselves sexually when they have sex? How do they position themselves? And if they're talking about non-intimate positions, then it's not going to be conducive to connection. Right? Anything that's face-to-face, eye-to-eye, missionary position stuff is most conducive to connection. Anything that's face-to-face, right? It's super important to generating connection. Anything that's back-to-back or non-face-to-face will impact connection, of course, right? Also, when it comes to fertilization, male superior is not as good for fertilization. Female superior position is better for fertilization. Didn't know that, right? So if you're having trouble having kids, female superior, male inferior, where it belongs, right? Also, if you're having trouble with pain in sex, female superior is better because the woman can control the depth and the speed of sex. Where if there's pain involved, then the man's in control, but he doesn't have the same sensitivity to that. So that's another thing. If it's for pleasure, some positions are more pleasurable than other positions. There's a G-spot on the woman. This is still debatable, by the way. Can you believe it? After all the science, we're still debating the G-spot? It's right underneath the cervix, and the certain positions, sexual positions will stimulate the G-spot, and certain positions will not. They call it like the second layer of orgasm. It's like deep orgasm, when the G spot is stimulated. So it has to do with the inner wall of the cervix, and then you have the external stimulation that has to do with the clitoris, right? And so a lot of orgasm will have the clitoris alone, but not the G spot. And so certain sexual positions will stimulate the clitoris and the G spot, and other ones will not. And so it's, again, the point is not to have, you don't have to have orgasm during sex, because most don't. But as far as pleasure in sex, so there's some more pleasurable and less pleasurable positioning that goes on. So I kid you not, when I used to teach this class, I removed these. It's so funny. You guys remember Dr. Bowman? If you guys know Dr. Bowman, he used to teach here. I got this lecture for years, and he taught it with me one year, and I said, okay, well, you get these slides. There was the sexual positioning slides, and they were all cartoon characters. And he was like, okay, next slide. If you want the old presentation, I'll send it to you. It's got sexual positioning, and it's got the sexual system for females and males. I'll post it for you. There was just so many times I do it, and there's just so much embarrassment. And I mean, it was on this screen, too, every year I teach, like, whoa. You know, like, there it is. Not actual pictures, but. Okay, so sex education can be important, especially for people who are getting married, who've never had sex before. Like, as part of the premarital sex talk, is to talk to them about positions and about the function of sex and all the stuff that you've been learning tonight. Do most women experience orgasm during intercourse? We answered that. What is most arousing for women and for men? Knowing that. What is most arousing? If it's part of it is pleasure and pleasure's low, what's most arousing for men and women? Do you guys know? Personal experience might tell you. No one's going to answer this question. What's most arousing for women and for men?
Well, isn't men more physical while women would be more mental things for arousal?
Can be, yeah. More foreplay. Slow foreplay, gentle touch, right? Not aggressive. Yeah, the more aggressive it becomes, less stimulating it is. Yeah, there's other things. You guys didn't have a sex education class. Sad. Any other ideas? Visual, men.
They're more emotionally connected
Emotionally
to their partner.
connected.
They need that emotional connection more than I think it's visual.
Yeah. They need more of the eye-to-eye
Right.
experience. It feels less objectifying if they're eye-to-eye. A lot of kissing. A lot of kissing. Right? I mean, if you want to produce oxytocin, did you know that when you kiss, the testosterone from the male saliva enters the woman and it raises her arousal? Kissing. That's awesome, right? like if a guy wants to know how to arouse his wife, say kiss her more. On an emotional level and a psychological level. And on a physical level, you actually send testosterone in the body, which increases her testosterone level, which arouses her. Kissing is really important. It should be for both people. Kissing part. Oh gosh. Do sexual positions impact the goal of intimacy, arousal, and fertilization? I talked to you about that. Okay. All right. Other things to be considered is other causes: alcohol, cigarettes, non-prescription drugs like antihistamines, topical vaginal medications. Those are other things you can ask about. All right, so here's the sexual interview. Okay. Questions to ask: history. What is the problem in your understanding of it? What was it like growing up in your family? Has to do with family origin. What was your family's attitudes and beliefs about sex? This would be great questions for premarital. How it was talked about, or whether it was unmentionable. How did you find out about sex? Some history stuff. Here's some current stuff. Their relationship and sexual history. When did you learn about sex? How did you learn about sex? Have you ever had sex before? Right? Who have you had sex with? Have you ever had sex that was painful for you? Have you ever had sex in a way that would be considered out of the normal? Like exhibitionism? You know, anything that's sort of sexually deviant a little bit? What is it like for you now? Work, relationships, any problems they perceive? What is your reason for coming now, as opposed to coming years before? What's changed? So then you want to start interviewing for desire, arousal, orgasm, and resolution. So what are your feelings about sex? Have you experienced any negative emotions about sex? When did they first begin? Have you ever experienced positive sexual desire for your spouse, for a previous mate? I've had couples who come in where they've had a lot of desire for their previous mate, and very little for the one that they're with. So, what if anything helps increase your desire for sex with your spouse? What hinders it? What efforts have you made to try to cultivate appropriate sexual desire? What worries you about trying to cultivate desire? Even talking about it. There's a lot of couples that don't talk about their sex. Like what feels good, what doesn't feel good, you know, what they like, what they don't like. Like that's really important during sex to be talking. And then there's a lot of embarrassment and shame. You know, like if sex just for procreation, then we don't talk about it. You know, but talking about it is super important. What efforts have they made to try to cultivate? Oh, I already said that one. Okay. Interview for arousal. Have you had difficulty achieving or maintaining arousal through sexual activity?
I have a quick question on that. Like how often would you say those conversations like need to have, you know, so kind of like multiple different perspectives on that?
Well, I think definitely anytime you try out something new,
okay,
there needs to be that conversation. I also think it's pretty healthy to have that conversation almost every time you have sex, because the woman is in a different phase, both just in the 20 minutes and also within. So just to be able to be, hey, does this feel good? Is this okay? Are you comfortable? You know, do you feel connected? That's a great question to ask before sex. Do you feel connected right now? You know, because to push a sexual experience onto someone who doesn't feel connected is dehumanizing to them. What happens when you lose your arousal? What is necessary to achieve physical, emotional arousal for sex? Who initiates sex? This one's a great question. Who initiates sex? How? Is it planned? Is it spontaneous? And what's the frequency? So who initiates sex is telling, right? How is it initiated? And there's really abrupt ways of initiating sex, and there's very gentle ways of initiating sex. You know, I have a couple right now with a sexual expectation of male sex every day. And so they've actually been having sex every day for probably like 10 years. It's like, wow. And so how does he approach her on sex? I mean, they don't even, it's just like, he comes home and that's the first thing to do. So there's no novelty to it, there's no spontaneity to it, there's frequency, and it's planned. I have questions too from couples that'll say, is it okay to plan sex? What do you guys think?
Yeah.
Yes?
Sometimes you have to. You gotta, like, I hate to say it, you gotta schedule it.
Right.
Like, especially if you've got all those kids bebopping around.
Right. Yeah. I think scheduling it can be a really good thing. I think you can overschedule it to where it's a bad thing. And then also, one thing I've noticed is that if you schedule it, there can also be disappointment. Because I can tell you right now, for a man, you put it on the calendar, and that doesn't happen, right? It can lead to anger and resentment.
You've committed.
Yeah, you've committed, right? It'd be better for you to put it on a calendar 30 minutes from now than to put it on a calendar 2 days from now, or like in the morning, or that's the downside of it, because the expectation, there's not as many things interfering with the follow-through of scheduled sex for a man than there is for a woman, right? And so that's a big deal. And there has to be some flexibility. If you're going to schedule it, some flexibility to say, you know what, this isn't going to work out. I'm not in a good place. I'm exhausted. Rather than just doing it because it's on your schedule.